Hi, I'm Molly Sullivan with Tennis MD, your source for all your tennis health, fitness, and injury information. Although tennis players don't typically get MCL injuries, they can occur off the court. MCL injuries are often caused by a blow to the outer side of the knee, causing the ligament on the inner side to stretch and tear. The pain and injury will cause tennis players limited mobility and misplay. Today we visit with Dr. Mcl, sports medicine orthopedic surgeon, to tell us more about MCL injuries.
The MCL is a ligament on the inner side of your knee that helps to prevent your knee from buckling inward. The MCL tears usually from a lateral blow to the outer side of the knee. The symptoms of an MCL injury are pain, stiffness, and sometimes, if the degree of injury is severe, instability. The treatment for an MCL injury depends on the degree of the injury. For a minor injury that is stable, the MCL is usually treated with range of motion and physical therapy. Icing, anti-inflammatory medications can help minimize the symptoms. A moderate degree injury to the MCL is usually treated also with a brace with a hinge to prevent side-to-side stresses on the MCL. A complete MCL tear can sometimes be treated surgically if combined with another ligament injury. But even in this situation, if by itself, it would be treated with a brace and physical therapy. An athlete with an MCL injury can usually play with a minor or a moderate injury if braced properly. A significant tear to the MCL usually requires a time of healing in the brace before appropriate strength and motion can be recovered to allow the athlete to play.
Mcl ligament tears, again, it usually is a deep tear and close to the joint, but it is fairly easy to rehab. Again, types of modalities that are designed to reduce inflammation are certainly helpful. You can use iontophoresis, which is a kind of electric stim current with anti-inflammatory meds that pushes it into the tissue. You can use infrared light therapy that helps to promote healing process greater. And then, of course, exercise. Biking, stationary bike, is really beneficial I find, in rehabilitation of the medial collateral ligament. It puts a nice stress to the ligament as it's healing, but it's no weight bearing, basically. So you do want to stay away from weight bearing exercises. And then strengthen the quad and the hip. Recovery time for a medial collateral ligament strain could be as little as 2 weeks. It could be as long as 8 weeks, 2 months, depending on the degree of the strain.
Be sure to keep these tips in mind when you prepare for sports and want to stay strong and healthy. I'm Molly Sullivan with TennisMD.com. Remember, at TennisMD, health equals performance.